Hello everyone, Dr. Alex Vasquez here with our next video, which is going to discuss antiviral nutrition. I'm going to provide you an update. This will be the first update for 2018. If I'm providing an update, then obviously that information will be kind of founded upon and predicated upon some previous information. So let's take a look at those sources right now. This series of updates builds upon previously published books, articles, videos, and blogs. In 2014, I published a book, small book, called Antiviral Strategies and Immune Nutrition. It's also available as an ebook through the Amazon Kindle platform. That was also published in 2014 under the name of Antiviral Nutrition. I also published a kind of an editorial journal article called Unified Antiviral Strategy in 2014. You can get that online for free. And I also did a presentation in 2016 at the International Congress on Naturopathic Medicine in Barcelona. You can see that on the internet for free as well, and I've provided you the website address. Also in 2014, I published a series of videos which you can find online for free if you're interested in looking at those. If you want kind of an independent view of some of these topics, the best article that I could recommend for you would be this one from British Journal of Nutrition 2007. Selected vitamins and trace elements support immune function by strengthening epithelial barriers and cellular and humoral immune responses. So if you want kind of an independent view of some of the things we're going to talk about today, again, you might look at that article, British Journal of Nutrition 2007, October. So when we talk about viral infections, which is mostly what we're talking about today, we're going to talk about viral infections, a particular viral infection, and its relationship to vitamin D status and its response to vitamin D supplementation. So again, kind of laying the foundation and putting all of this in a reasonable context, when we talk about the treatment of viral infections, we have to have kind of a comprehensive way of looking at that, not just talking about virus here and virus there. As you can imagine with the book, I've developed not simply an antiviral strategy, but also a more cohesive and comprehensive way at looking at viral infections and their clinical complications. So, as I said in 2014, I'll state it again here, if you don't have a structured understanding of a good, comprehensive antiviral strategy, then you really don't have either an understanding or a strategy. And I can say that, after having gone through 3 different doctoral programs, we never learned a antiviral strategy. We never learned how to understand viral infections in a comprehensive way that would really leverage the clinical tools that we have for optimal effectiveness. And when you look at my strategy, you get to see some ways that you can intervene and understand how these viral infections progress and how the body responds, and that provides you some insight into ways that you can treat these viral infection-related diseases, whether those are acute infections or persistent infections that go on to have other complications. So at the very least, let's touch upon these major 4 categories, starting with antiviral interventions. We can target the virus itself. We can use anti-replication interventions, that is, targeting the machinery of viral replication. We can attack that process as well. We can use immunomodulation and immune nutrition because obviously the immune system does usually a very competent job protecting us from these viral infections. So let's optimize immune function, and that usually means nutritional supplementation. We can also use cell and systemic support to mitigate some of the consequences of viral infections. And of course, I'm talking about inflammation, oxidative stress, and of course, mitochondrial impairment, which accompanies many viral infections. So when we start to kind of deconstruct this phenomenon of viral infections and we look at each of these components, we can intervene at each of these levels or layers, we might say, and provide better treatment, whether we're treating ourselves or whether we're treating our clients. So today we're going to talk about vitamin D in the treatment of a very common type of viral infection, and most of that work is going to put us here in this 3rd category of immune nutrition, but also you'll see some implications for this anti-replication category as well. So let's go ahead and start taking a look at this article that we're going to focus on today, which is Effects of Long-Term Vitamin D Supplementation on Regression and Metabolic Status associated with cervical intraepithelial neoplasia. Source: this article comes from Hormones and Cancer, February of 2017. You've got the digital object identifier here as well. This is a randomized double-blind placebo-controlled trial with 58 women with cervical intraepithelial neoplasia grade 1. The intervention was 50,000 international units of vitamin D3 each 2 weeks, so that averages out to a bit over 3,500 international units per day for 6 months. And overall, I consider that intervention to be reasonable. The dose is reasonable. It's certainly not heroic. 4,000 international units per day is considered to be kind of the minimum for replacing vitamin D in patients who are deficient. We might use higher doses, closer to 10,000 international units. I think that would have been a bit more robust and not necessarily heroic. And 6 months of duration is certainly the minimum. We wouldn't want to see a study, for example, for 2 months or 3 months or 4 months, but 6 months is acceptable and the dose is acceptable. So we can evaluate this study thinking that this might actually be a reasonable representation of competent clinical practice. And that's an important place for us to start, because a lot of these studies using vitamin D have used inadequate dosing and inadequate duration, and they reach the conclusion that vitamin D is inefficacious for whatever it is that they're investigating. And really, vitamin D is not at fault. The fault lies with the researchers for poorly designing their studies. And I've published guidelines on the use of vitamin D in clinical practice, as well as guidelines for designing clinical trials. You can download those articles from the internet for free. But let's move on in our discussion of this article. Results of this study: after 6 months of vitamin D administration, a greater percentage of women in the vitamin D group had regressed their cervical intraepithelial neoplasia grade 1, 84% success versus 53% in the placebo group. They had improved vitamin D status. That's another thing that we always want to look for in studies. They always need to actually measure vitamin D levels, not simply give people vitamin D and assume it was a properly manufactured supplement with good absorption, etc. We actually have to measure vitamin D response by looking at 25-hydroxyvitamin D in the serum. These patients also benefited from showing reduced serum insulin levels and improved insulin sensitivity. They had improved antioxidant defenses. They had elevated glutathione levels relative to the placebo group, and they had reduced oxidative stress as well. Excellent safety, and the authors barely mentioned modulation of the vaginal microbiome, and I think that this effect is likely of major importance, and this is probably where a lot of the power of this intervention is coming from. Not necessarily the systemic administration of vitamin D, but the effect that that vitamin D has on systemic inflammation, but also immune function and the modification of the vaginal microbiome via improved immune function, via vitamin D supplementation. I think that's probably where the action is here in terms of mechanisms of effect of this intervention. Let's look at some more details and how we might understand the study a bit more. Biological effects of vitamin D3 when we're talking about optimizing serum levels and therefore body reserves. Vitamin D improves gut absorption of calcium. We're quite sure about that. Magnesium, probably. And also we see some new data showing that vitamin D might also improve selenium absorption. If vitamin D3 indeed increases selenium absorption, this would greatly explain the reported benefits in antioxidant status, reductions in mortality, and the antiviral benefits that are apparently being reported here. So selenium has antiviral effects, number one, by blocking viral replication, and number two, by blocking viral mutagenesis. And those are very important when the body's trying to combat these persisting viral infections. Reductions in physiologic elevations of parathyroid hormone, which reduces intracellular calcium. This is referred to as the calcium paradox. I've also published an article on that back in 2006, I believe, and it's also republished in my books. This reduction of parathyroid hormone reduces intracellular calcium, and the effect that we're looking for there, that we benefit from, is a reduction in excess inflammation and cell proliferation. Again, inhibiting excess cellular proliferation is one of the benefits of vitamin D. Also, inducing differentiation and apoptosis. Obviously, those have anti-cancer benefits. Vitamin D also reduces systemic inflammation. This has been very well documented. One very nice study back in December of 2002, published in the Quarterly Journal of Medicine, showed this very conclusively. Vitamin D metabolites inhibit the NF-kappa B pathway. This is very important because that NF-kappa B pathway drives viral replication. So anything that's going to block that NF-kappa B pathway, whether it's vitamin D, selenium, zinc, etc., is going to probably provide some antiviral benefit by reducing viral replication. Vitamin D also improves immune efficiency, increased resistance to infections and dysbiosis with improved immunotolerance. So, a lot of times people have kind of a simplistic view of the immune system, whether it's overactive, resulting in allergies and autoimmunity, or underactive, resulting in increased susceptibility to infections. But what we see with vitamin D is actually improved resistance against infections and dysbiosis, and also improved tolerance at the same time. The expected result would be a reduction in allergy and autoimmunity. Certainly a reduction in autoimmunity has been documented, and also some increased resistance to infections. Now, in this context, when we're talking about cervical intraepithelial neoplasia, we have to talk about not simply the HPV virus, the human papillomavirus, but also the bacterial microbiome within the vagina, which obviously affects the cervix. So what I suspect is happening, for example, in this study, is that the administration of vitamin D is improving immune function. That's modulating the bacterial microbiome within the vagina. Obviously, that's directly adjacent to the cervix. And when the immune system of the vaginal mucosa is improved, that favorably modulates the bacterial microbiome within the vagina to reduce inflammation, and the reduced inflammation leads to a reduction in viral mutagenesis and viral replication. I suspect that that is the mechanism of action here. As I mentioned before, these patients also showed improved glucose insulin sensitivity. That's been shown in several other studies, so I think we can believe quite strongly in that. And several studies have shown reductions in elevated blood pressure as well. We consistently see with vitamin D supplementation improved mood, reduced neuroinflammation, and reduced pain. And well documented by William Grant's work are reductions in all-cause mortality and disease-specific mortality. So here I'll conclude with a brief summary and clinical contextualization. This study, Effects of Long-Term Vitamin D Supplementation on Regression and Metabolic Status of Cervical Intraepithelial Neoplasia, published in February of 2017 in the journal Hormones and Cancer. This is a small trial, but it is placebo-controlled, and it does provide encouraging data consistent with known benefits of vitamin D supplementation, whether that's provided systemically or directly vaginally, and again, specifically the effects that has on the vaginal microbiome. Enhancement of self-resolution, I think, is one of the major keys here, given the well-established fact that most people clear various human papillomavirus infections without consequence. Research such as this should be emphasizing those natural and endogenous factors that promote viral clearance. Medical interventions related to HPV disease include Pap smears, and these should be continued every 1 to 3 years. The controversial anti-HPV vaccination is expensive and has produced many biologically proven adverse effects, including autoimmunity, neuroinflammation, infertility, and death. And of course, that vaccine provides zero collateral benefits. In contrast, nutritional interventions such as vitamin D and methylfolate or calcium folinate safely provide numerous disease-specific and general collateral benefits. What we need in the future are well-performed clinical trials using a complete antiviral nutrition protocol such as the one that I published back in 2014. So thank you for your attention during this short video. What we're going to talk about in one of the upcoming videos is, again, the role of vitamin D in modulating the vaginal microbiome, reducing inflammation, and reducing the clinical consequences of various diseases.